And now let's talk about the medical eligibility criteria, guys. And I'll make it so simple for you that you will be able to answer it yourself without needing anybody. Now, first of all, a quick revision as to what is medical eligibility criteria 1, 2, 3, and 4. So first of all, medical eligibility criteria 1 means you can easily, safely give the drug. Do not think twice before giving and prescribing the drug. So if a person comes to you, let's say a young female of 25 years of age with no high risk factors, she falls in the category of medical eligibility criteria 1. She can be easily given and forgotten that she's been given OCPs. There is no risk. Eligibility criteria 2 and 3 are: 2 says the benefits are more than risks. 3 says risks are more than benefits. Okay? And class 4 says do not give. Okay? The risk is too high to give to this person. So basically contraindicated, MEC 4. So with this background, I'll ask you a few questions and you will give me the answers. And by giving those answers, we'll cover the entire medical eligibility criteria in 4 essential steps, right? So let's start with the age factor. I gave you the answer first one, okay? So age, let's say a female of less than now I'm going by the books in giving you this this question so that you remember along with me. Any patient who is less than 35 years of age, if she comes to you, you can easily give the OCP, and this falls in the criteria 1, MEC 1. If a patient comes to you with more than 35 years of age, she goes to the criteria 2, MEC criteria 2. She's just more than 35 years of age. That's what I said. Okay, now my question is, if a lady comes to you of, let's say, 38 years of age, that means she's more than 35, and she's smoking, I said 38, so she's smoking 28 cigarettes in a day. 28 cigarettes a day. She falls in which criteria? Should we give OCPs or we should not give? She falls in criteria 3 or she falls in criteria 4? That's your question. 38 years female, smoking 28 cigarettes a day. She falls in which criteria? MEC 1 or MEC 3 or MEC 4? Okay, guys, you know your subjects. All answers are right. Are you seeing in the book? Good, very good, very good. So all the answers are right. Any lady who is above 35 years of age and is smoking less than 35 cigarettes a day, 35, more than 35 but smoking less than 35 cigarettes a day, falls in the criteria category 3. Okay. Same question. If she's a 38-year-old female and she's smoking 38 cigarettes a day, then she falls in the criteria 4. That means you should not give to such a person, right? Now, this was about the age, and with this we finish with the age. Okay, age criteria is gone. Usually they'll ask you one of these 4 criteria. Then comes the breastfeeding. All right, very important. Okay, quickly tell me one thing before I go to breastfeeding. What about abortion? She just recently had an abortion. She just recently had an ectopic pregnancy. And now she's so scared about after the abortion. She doesn't want to get pregnant anytime soon now. And she's asking you for, advice. So if you do advise OCP to her, and considering that she's low risk otherwise, if you do consider giving OCPs to her, what will be the criteria? Will you safely give her? Will you ask her to wait for a couple of weeks? Or, you can just straight away give OCPs to her. Okay, let me put it a little easy for you. Suppose a patient who's just had a DNC under you. Okay, you ask her to come after her first period, let's say, okay? And now she's like, ma'am, I don't want to wait any further. What if I do get pregnant in this meanwhile? Please tell me what can I start straight away? Okay, and I say, okay, fine, after 1 week, because you might bleed for some time, after 1 week, you start with OCPs. And then I'm wondering whether I did the right thing or not. So is this advisable? Is it MEC criteria 1, 2, 3? If I give a patient who's just been through a DNC, after a week, I advise her OCP. Is it medical eligibility criteria 1, 2, 3, or 4? What's the answer? Okay, some people are saying 2. Okay, some people are saying 1, 2, what? Come on, guys, I need more answers from you. Whatever. You see, be it right or wrong, just keep answering. Okay, fine. So people are saying 2. Mostly everybody has said 2. The answer is 1. It's very, very safe. Okay, it's very, very safe to give after abortion or after ectopic the OCPs. Okay, and there is no ifs and buts. It's just safe to give. Okay, 1 week, 2 weeks is not important. You can give after 1 week. All right. So now comes the breastfeeding question. So okay, fine. Now a patient who's not breastfeeding. Okay. What is the advisable time to start OCPs in a patient who's just had a delivery or a C-section under you? When will you safely, that means medical eligibility criteria 1, start giving her OCPs if she is not breastfeeding? Mind you, when it comes to breastfeeding, I'll be talking different. Okay, and you'll be able to understand it better once I do show you through the charts. You answer it yourself now. What is the safe, that means MEC criteria 1 for people who are not breastfeeding? What is the time limit for starting the OCPs to people, to those females who are not breastfeeding? When will you start OCPs, if at all? Safely. Okay, 6 weeks, 3 weeks. Okay, good. Anytime. Okay. I've made a nice table. I can share this table with you. Yeah. 6 weeks, 3 weeks. Okay, good. Who says 3 weeks? Right. Answer is 3 weeks. Safely. For people, for those, women who are not breastfeeding, who've recently had a delivery or a C-section and they're not breastfeeding, 3 weeks, after 3 weeks, you can safely start OCPs. That means it belongs to category 1. Not breastfeeding, more than 21 days, belongs to category 1. What if you do give OCPs before 21 days to a patient who is just delivered, not breastfeeding? I have not gone to breastfeeding as of now. Non-breastfeeding, but less than 3 weeks, if you start OCPs, what does that become? Does that become a medical eligibility criteria 2, 3, or 4? And then I'll put a chart so that it's easy for you all to remember. Don't worry. This is just, you will remember by making these mistakes. Okay. Most of you are answering 2. Okay. Most of you are answering 2. The answer is 3. Okay. So it's not safe to give before 3 weeks because of the concerns of high level, incidence of venous thromboembolism in the first 3 weeks post delivery. Okay, remember that we used to give LMWH for 6 weeks postpartum, especially if they are on therapeutic dose, right? Even prophylactic dose used to go on to 3 weeks. So before 3 weeks, it's not safe to start with OCP. So it becomes medical eligibility criteria 3 for those patients who are not breastfeeding and who are starting with OCPs, but not before 3 weeks. Okay. Now we go to those patients who are breastfeeding the young ones. To start OCPs in those patients who are breastfeeding the young ones, what is the safe limit? What time will you start, if at all, OCPs in the patients who are breastfeeding?